What I'm about to tell you is going to change the way you look at every blood pressure reading you've ever taken. Because if you're over 60, there's a very good chance you've been worrying about the wrong number. And that mistake can cost you far more than peace of mind. It can cost you your balance, your heart health, your brain function, even your independence. I'm Dr. Michael Joel, and today we're answering a question that confuses millions of older Americans every single day. Which blood pressure number is more dangerous, systolic or diastolic? And the answer is not what most seniors think. Before we begin, please subscribe to my channel for clear senior health guidance that protects your heart, independence, and peace. If you stay with me, by the end of this video, you'll know which number deserves your attention first, when the bottom number becomes a hidden danger, and why one reading can look reassuring while actually putting you at serious risk. Because right now, somewhere in America, a senior is staring at a blood pressure monitor saying, well, at least the bottom number looks good. And that false reassurance may be the most dangerous part of the entire reading. Let me start with Walter from Columbus, Ohio, because his story reveals the mistake so many seniors make. Walter was 72, retired, careful, disciplined, the kind of man who wrote every blood pressure reading in a spiral notebook. One Tuesday morning, his monitor read 168/74. Walter looked at the bottom number, saw that 74, and felt relieved. That's not too bad, he told himself. My diastolic is normal. And that one thought stopped him from calling his doctor for 3 weeks. He focused on the 74. He ignored the 168. That was the number quietly damaging his arteries the whole time. When Walter finally came in, he asked me the question I hear all the time. Doctor, which one matters more, the top number or the bottom number? And I could see from his face that he wanted a simple answer. Seniors deserve simple answers, but simple does not mean shallow. Because the truth is this, for most adults over 60, the top number, the systolic pressure, is usually the more important warning sign over the long term. Not always, not in every situation. But most of the time, and especially in older adults, systolic pressure is the number more strongly tied to future stroke, heart attack, heart failure, and kidney damage. Now, before I explain why, you need to understand what those two numbers actually mean, because this is where almost everyone gets lost. Systolic is the top number. It measures the pressure in your arteries when your heart squeezes and pumps blood forward. Diastolic is the bottom number. It measures the pressure when your heart relaxes between beats. That sounds simple, but it hides something crucial. As you get older, your arteries stiffen. They lose that soft, elastic give they had in younger years. And when that happens, the top number tends to rise while the bottom number may stay normal or even drift lower. That is why so many seniors develop something called isolated systolic hypertension. And don't let that complicated name intimidate you. It simply means the top number is high while the bottom number is still in a range that looks acceptable. A reading like 158/76 or 64/78 or even a 72/72. And this is exactly why older adults get fooled. They see one good-looking number and one bad-looking number, and they assume the good number cancels out the bad one. It doesn't. In many seniors, that high systolic number is the main danger marching silently forward. Let me tell you about Shirley from Phoenix, Arizona. Shirley was 69, active, independent, still driving everywhere, still helping with her grandkids. Her readings kept landing around 156/68. She ignored them because of that 68. If my bottom number is low, how bad can it be? She said. But what she didn't understand was that her low normal diastolic wasn't protecting her from the high systolic. Her arteries had become stiff with age, so every heartbeat was hitting those vessel walls with more force. The pressure surge was damaging them, even though the resting number between beats didn't look alarming at all. Here's the picture I want you to hold in your mind. Imagine an old garden hose. When it's new, it stretches a little when water rushes through it. When it's old, dry, and stiff, it doesn't flex well. The pressure shoots higher. That, more than anything, is what often happens in older arteries. The top number rises because the blood has nowhere soft to go. So after age 50, and especially after 60, systolic blood pressure usually becomes the better predictor of long-term cardiovascular trouble. That's why many doctors focus so intensely on that top number in seniors, even when the bottom number seems fine. But now I need to slow down for one moment, because if you misunderstand what I just said, this video could actually harm you. I am not saying the bottom number doesn't matter. I am not saying diastolic pressure is harmless. I am not saying you should only pay attention to the top number and ignore the rest. That would be a dangerous oversimplification, because there are situations where the bottom number becomes extremely important, suddenly important, even life-threateningly important. And if you miss those situations, you can end up making the exact opposite mistake from Walter and Shirley. Let me introduce Bernard from Tulsa, Oklahoma. Bernard was 66, and his reading one afternoon was 128 over 102. He looked at the top number and smiled. 128? Great. I'm doing fine. But his bottom number was 102. That is not fine. That is diastolic hypertension. And in Bernard's case, the danger wasn't that his systolic looked terrible. It didn't. The danger was that he used one decent-looking number to excuse one clearly abnormal number. When your diastolic pressure is elevated, especially repeatedly, it still matters. It still increases cardiovascular risk. It still deserves evaluation. It still tells your doctor something important about your circulation. So now we arrive at the real answer. Which blood pressure number is more dangerous? For most seniors, systolic is usually the more dangerous number in terms of long-term risk because it is the one most likely to stay elevated with age and the one most strongly linked to major events. But diastolic becomes very dangerous in two situations. First, when it is very high. Second, when it becomes too low in the wrong person, especially an older adult with heart disease, dizziness, weakness, or aggressive blood pressure treatment. That is the part almost no one explains clearly, and it changes everything. Let's take the first danger zone, a very high diastolic pressure. If your bottom number is staying in the 90s or climbing into the 100s, that is not something to brush off because your top number looks decent. High diastolic pressure means the pressure inside your arteries is staying elevated even when the heart is resting. And that can strain the heart and blood vessels over time. In younger adults, isolated diastolic hypertension shows up more often. In older adults, it's less common than isolated systolic hypertension, but when it's there, it still matters. It still deserves medical attention. It still means your monitor is telling you something important. Now let's talk about the second danger zone, and this is where seniors need to listen carefully. A diastolic pressure that gets too low can also become a problem. Why? Because your heart muscle itself gets much of its own blood supply during that resting phase between beats. That means if the bottom number falls too low, especially in an older person with stiff arteries or coronary artery disease, the heart may not get the blood flow it needs as comfortably. This is one reason some seniors feel weak, lightheaded, washed out, or not like themselves, even while being told their blood pressure is beautiful. Let me tell you about Gloria from Tampa, Florida. Gloria was 78 and had worked hard to get her blood pressure down. Too hard, actually. Her readings dropped from 162 over 84 to 118 over 58 after medication changes. Everyone celebrated at first. The top number looked wonderful. The bottom number looked low, but maybe acceptable. But Gloria started feeling exhausted. She grew dizzy when standing. She stopped taking her morning walks because she felt shaky. Her family thought she was just aging faster. She wasn't. Her blood pressure treatment had pushed her into a zone where the numbers looked cleaner than the way her body actually felt. That is why I need you to hear this next part very clearly. The most dangerous blood pressure number is not always the highest one on the screen. Sometimes it is the number that doesn't fit your age, your symptoms, your medical history, or the pattern your body is showing you. A systolic of 1 in 70 is dangerous even with a nice-looking bottom number. A diastolic of 102 is dangerous even with a decent top number. And a diastolic of 58 in a medicated, dizzy, older adult may also be dangerous. Context matters. Pattern matters. Symptoms matter. One number never tells the whole story alone. But for pure long-term risk in most seniors, if you force me to choose one, I choose systolic. And I choose it without hesitation, because after age 60, the top number is usually the one quietly driving the bus. It is the number more likely to be elevated. It is the number more likely to reflect stiffened arteries. It is the number more strongly tied to the kind of damage that accumulates over years, not days. Stroke risk, heart failure risk, kidney strain, brain small vessel disease, all of these track closely with uncontrolled systolic pressure in older adults. That is why a normal bottom number can be so misleading. And here is the exact mental trap that catches seniors. They still think blood pressure works the way it did when they were 35. Back then, a high bottom number may have stood out more. Back then, the pattern was different. But the body changes. Arteries change. Risk changes. The problem is that many seniors carry an old rule into an older body. They assume the bottom number is the real number. They treat the top number like noise. That is yesterday's logic. In older adults, the top number often becomes the headline. And if you ignore that headline because the bottom number looks calm, you can miss the real threat. Let me show you how this confusion hurts real people. Frank from Des Moines, Iowa, had readings around 166 over 77 for months. He didn't worry. Nancy from Sacramento had readings around 134 over 96 and assumed she was better off than Frank because her top number looked lower. Both were wrong in different ways. Frank was underestimating a dangerous systolic. Nancy was underestimating a dangerous diastolic. And that is why comparing one reading to another without understanding the pattern can be misleading. Blood pressure is not a contest where one person wins because one number looks prettier. It is a signal. You have to interpret the whole signal. Now I want to take you one layer deeper because this is the part that creates real wisdom. In seniors, it's not only the individual numbers that matter, it's also the gap between them. That gap is called pulse pressure. If your blood pressure is 170/70, that gap is 100. That's wide. A very wide pulse pressure can suggest increased arterial stiffness, which is common with aging. And when I see a senior with a high top number and a much lower bottom number, I don't relax because the diastolic looks pretty. I lean in harder because that pattern often tells me the arteries have lost elasticity. This is why some of the most dangerous readings in older adults do not look dramatic at first glance. A senior may see 162/64 and focus only on the 64. But that wide spread is not automatically comforting. It may actually be another clue that the vascular system is under strain. On the other hand, a reading like 132/94 looks less dramatic because the top number isn't exploding off the screen, but the persistently elevated bottom number still needs attention. Different patterns, different meanings, same lesson. Never let one number distract you from the message of the full reading. Now let's talk about the emergency zone because this is where hesitation becomes dangerous. If your blood pressure is above 180/120, that is a crisis level reading. And if it comes with symptoms like chest pain, shortness of breath, weakness, trouble speaking, vision changes, severe back pain, or numbness, that is not a wait until tomorrow situation. That is emergency care territory. In that moment, do not sit at the kitchen table debating whether the systolic or diastolic number is the real problem. They are both the problem. The body is telling you the pressure is dangerously high, and symptoms mean you need immediate medical help. Let me tell you about Eleanor from Pittsburgh. Her reading was 184/86, and because the bottom number was under 90, her husband thought maybe it wasn't truly serious. But Eleanor also had trouble finding words and felt weakness in her right hand. That right there is where people lose precious time. A top number can be crisis-level dangerous even if the bottom number doesn't look as frightening. Symptoms always outrank your interpretation. Symptoms outrank your reassurance. Symptoms outrank internet guessing. If the reading is severely high and the symptoms are new, you don't argue with the monitor. You act fast. So what should seniors actually do with all this information? Here is the rule I teach my patients. Number one, never ignore a high systolic reading just because the diastolic looks normal. Number two, never ignore a high diastolic reading just because the systolic looks acceptable. Number three, never celebrate low numbers if you feel awful. And number four, never judge your blood pressure from one isolated reading taken under poor conditions. Patterns over time matter far more. Blood pressure after an argument, after climbing stairs, after coffee, or while you're anxious is not always telling the truth about your usual state. That brings me to another dangerous misunderstanding. Some seniors become obsessed with whichever number scares them most. They check repeatedly, panic, recheck, panic again, and create a spiral. Blood pressure is reactive. Fear changes it. Pain changes it. A full bladder changes it. Talking changes it. Movement changes it. So if you truly want to know whether systolic or diastolic is causing concern in your life, you need accurate measurements taken the right way at consistent times under calm conditions. Otherwise, you are trying to solve a medical puzzle with bad data, and bad data creates bad decisions. Here's the calm, useful way to monitor. Sit quietly for 5 minutes. No television. No phone conversation. Feet flat on the floor. Back supported. Arms supported at heart level. Empty your bladder first. Use the correct cuff size. Measure on bare skin. Take 2 or 3 readings 1 minute apart. Write them down. And do this morning and evening for several days if you and your doctor are trying to understand a trend. That's how you find out whether your top number is persistently creeping higher, whether your bottom number is falling too low, or whether one strange reading was just noise. Now let's answer the questions seniors are really asking underneath the title of this video. They're not only asking which number is more dangerous. What they really mean is which number should make me worry. And the honest answer is this. In an older adult, a consistently high top number should absolutely get your attention even if the bottom number looks okay. A persistently high bottom number should also get your attention. And a bottom number that drops very low while you feel weak or dizzy should get your attention too. Worry is not the goal. Awareness is the goal. Timely action is the goal. Let me give you 3 examples you will remember. Example 1, 172/76. For most seniors, the top number is the main danger there. Example 2, 128/98. The bottom number is the main danger there. Example 3, 116/58 with dizziness and fatigue after medication changes. In that case, the low diastolic and the symptoms may be the problem. Do you see what's happening? The answer changes with the pattern, but if we zoom out and ask which number usually causes more long-term concern in older adults, the answer is still systolic. That is the number seniors most commonly underestimate. And there is one more reason systolic pressure is so sneaky. It often doesn't make you feel anything. No alarm, no warning pain, no dramatic signal. A senior can walk around with systolic pressure in the 150s or 160s and feel pretty good. That is why high systolic blood pressure is so dangerous. It does its work quietly. It damages the blood vessels in the brain, eyes, kidneys, and heart over time, while the person carrying it tells friends they feel fine. Feeling fine is not proof your blood pressure is safe, and feeling worried is not proof your pressure is dangerous. The monitor and the pattern matter. On the other hand, low diastolic pressure can fool people in the opposite direction. Seniors are often praised for low numbers. Lower, 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 as if all lower numbers are automatically healthier. But your body is not a scoreboard. It is a living system. If the bottom number is getting pushed down and you're becoming exhausted, lightheaded, or unsteady, that deserves a conversation, especially if you have heart disease, diabetes, kidney disease, or a history of falls. And especially if medication changes happened recently, the right blood pressure is not just the prettiest reading. It is the reading your body can live with safely. Let me tell you about Harold from Nashville, Tennessee. Harold became so focused on lowering his top number that he never mentioned to anyone that he had started seeing black spots when he stood up. His blood pressure looked great on paper, but his diastolic pressure had drifted into the high 50s and he felt miserable. He thought that meant the medication was working perfectly. It didn't. It meant the treatment plan needed adjustment. Too many seniors suffer because they think symptoms don't matter if the machine looks happy. That is backward. The machine matters. Your symptoms matter too. Both belong in the conversation. So here is the sentence I want burned into your memory. For most seniors, systolic blood pressure is usually the more dangerous number over the long run. But diastolic pressure can still become dangerous when it is too high or when it falls too low in the wrong person. That is the mature answer, not the catchy answer, not the simplistic answer, the true answer. And the seniors who stay safest are the ones who stop looking for one magic number and start looking for patterns, symptoms, and context. That is how you protect your heart. That is how you protect your brain. That is how you protect your independence. If you remember nothing else from today, remember Walter, Shirley, Bernard, and Gloria. Walter ignored a dangerous top number because the bottom number looked fine. Shirley did the same. Bernard ignored a dangerous bottom number because the top number looked reassuring. Gloria trusted low numbers even when her body was telling her something was wrong. 4 different mistakes. One shared problem. They all misunderstood what the numbers meant. And misunderstanding blood pressure is expensive. It costs time. It costs confidence. It costs quality of life. Sometimes it costs years. That is why this topic is not just technical. It is deeply personal. Now let me give you the clean takeaway your family can actually use. If you are over 60 and your top number keeps showing up high, do not let a normal bottom number talk you out of taking it seriously. If your bottom number is repeatedly high, don't dismiss it because your top number looks better. If your bottom number is getting very low and you feel weak, dizzy, or unstable, speak up. And if either number reaches crisis levels with symptoms, get emergency help. Blood pressure does not reward denial. It rewards attention, consistency, and action. That is what keeps seniors out of trouble. I also want you to stop asking, which number should I ignore? Because that is the wrong question. The right question is, what is this pattern telling me? Is the top number chronically high? Is the bottom number chronically high? Is the gap widening? Did symptoms begin after medication changes? Are readings only high when you're anxious or rushing? These are the questions that lead to good medicine. And good medicine is never just about chasing a pretty number. It is about reducing risk without making you feel worse. That balance matters more in your 60s, 70s, and 80s than most people realize. Before we finish, I need to say one thing directly to the seniors watching this alone in a quiet room, maybe after seeing a number that frightened them this morning. Do not panic over one reading, but do not dismiss a pattern either. Those are 2 different mistakes and both are common. Measure correctly. Track consistently. Bring the log to your doctor. Tell them how you feel, not just what the monitor said. Your blood pressure numbers are not there to scare you. They are there to inform you. And once you understand which number means what, that fear starts turning into control. So Which blood pressure number is more dangerous, systolic or diastolic? For most seniors, systolic is the more dangerous number over time. That is the headline. But the fine print matters because diastolic still matters when it is too high, and it can matter when it becomes too low. One number does not erase the other. One number does not excuse the other. And one number never tells your whole story by itself. Read both. Respect both. But if you are over 60, never underestimate the top number just because the bottom one looks polite. That mistake is far too common. If this video helped you understand your blood pressure in a way no one has explained before, subscribe to the channel and share it with another senior, a spouse, a sibling, or a friend. Because someone you love may be staring at a reading right now and drawing the wrong conclusion from it. And sometimes the difference between prevention and crisis is just one moment of understanding. Protect your heart, protect your brain, protect your independence. Take your numbers seriously, take them correctly, and I'll see you in the next video.